Hey everyone, thanks for checking out my channel. In this video, we're going to go over cervical radiculopathy. That's where you're having pain or numbness, tingling, burning sensation that's coming from the neck, maybe around the shoulder blade, into the shoulder, down into the arm and hand. Simple techniques you can do at home to reduce your symptoms. Our first technique, we're going to perform cervical retraction and a scapular squeeze or scapular retraction at the same time using one of these exercise bands. I'm going to bring my elbows in by my side. I'm going to squeeze my shoulder blades together. So this is more of not just a shoulder movement. As I squeeze my shoulder blades together, the band kind of comes apart. I'm going to retract my cervical spine, so I'm retracting back, squeezing that back at the same time. So I'm going to go back, hold that for about 2 to 3 seconds, and repeat that for 2 to 3 sets of 10 to 12 repetitions. For our next technique, we're going to take a pillowcase, put that right at the base of our skull here, and then I'm going to work on a cervical rotation, and I'm going to pull with a pillowcase. So what I'm going to do is I'm going to look to the left. So if I look to the left, my hand on my right side is going to travel with my head as I look to the left and come back to the midline. I'm going to kind of pull. I'm keeping tension this whole time, pulling upwards almost through my eye as I go up. I'm going to hold that about 2 seconds and come back. Then repeat that to the other side. So as I look to the right, I'm going to pull with my left hand, coming up, going through the eye and back down. I'm going to rotate again, pulling up through the eye, hold that about 2 to 3 seconds, and back down. Repeat that for 2 to 3 sets of around 10 repetitions. This will be a form of cervical traction that's really easy. Now you can use those over-door traction units or some of those that pump up that stretch the neck and kind of open up that space between the nerve roots. This is just a simple way you can do at home. You're going to go to the edge of your bed and you're just going to lie so that either you can prop up your arms like this and kind of go over the arms, or you can just let your head hang off like this. And so my head and neck is just hanging off, and let that hang maybe somewhere between 30 to 60 seconds and then come back up, and then repeat that again several times a day. Be careful with that if you have increased intracranial pressure when you're doing that. So if you do that and you're, really feel like your eyes or have a lot of pressure or kind of get a headache, definitely don't do that movement. But that's an easy way to kind of open up those spinal segments. Next is going to be a nerve flossing technique. So there's a lot of these different techniques you can use. It's just one of my favorites. So what you're going to do is bend the elbow and the wrist into flexion. So I'm flexed here and flexed at my wrist. I'm going to lean my head away so my left ear is going to my left shoulder. This is the right arm that we're using. And then what I'm going to do is, as I bend my head so my right ear comes to my right shoulder, I'm going to extend my right elbow and extend the wrist. We're going to go back and forth. So as the hand comes over, the head moves away, just back and forth. And I repeat that for 2 to 3 sets of 10 to 20 repetitions. This stretch technique is definitely one of my favorites, whether you're having neck tension or pain, shoulder pain, upper extremity pain. It's just a distracting stretch. It works really well and it's simple to do. All that you're going to do is grab a hold of the bottom of a chair. I'm going to lean away, and as I just lean away, I'm going to feel that stretch down through my shoulder, down through my upper extremity. We can add an additional stretch to this on the head and neck. So I'm going to come up and I'm going to pull over, and I feel that stretch on the side of my neck. Now if that makes the symptoms worse, then obviously don't do that. You may just be able just to lean and not add in the neck stretch. But that's something you can do, and you hold that for about 15 to 30 seconds and repeat that several times a day. Our last technique, and definitely one of my favorites, you're going to use a tennis ball, put this into a pillowcase. You can use a sock or even just a plastic bag. We're going to go right on my back here where my shoulder blade kind of is close to my spine. You can move this up if you'd like. I'm just going to lean in and hold that pressure. And as I hold the pressure, I'm going to tilt my head so that my right ear is going to go to my right shoulder, because I have the tennis ball on the left side. I'm going to hold that stretch, just kind of leaning in. Then I'm going to repeat that to the other side. So I just move the tennis ball over to the right side of my spine, and then I would lean my head and neck away from that side. That's something I'm going to hold maybe for 15 to 30 seconds several times a day. If you don't want to use a pillowcase and lean up against a wall, you can just take the tennis ball, lie flat on your back on all those areas you're getting back there in that upper back area and the neck area where you feel that tension. Just relax and let the muscles just kind of calm down a little bit. Thanks so much for watching this video. I hope that it helps with your symptoms of cervical radiculopathy. Make sure you hit that subscribe button so you can stay up to date on all my content.